I'm Roger Baker, Executive Director of the Stratfor Center for Applied Geopolitics at RANE, a global center of excellence for geopolitical intelligence and analysis. Learn how you can put geopolitics to work for your organization at ranenetwork.com.
Welcome to the Beyond COVID podcast from RANE Network. In this podcast series, David Lawrence, the founder of RANE, speaks with Dr. Fred Southwick, an infectious disease specialist at the University of Florida's College of Medicine, and Dr. Bill Lang, an expert in public health responses to biological incidents about the infectious disease landscape.
Bill and Fred, thank you again once more for joining us. This will be a brief podcast, but with the holiday season ahead, I thought it would be helpful for everyone to get the best advice about what's happening around the world and what people have to be concerned about with respect to infectious diseases. And obviously a lot of people will be traveling during this holiday season. So maybe Bill, I'll kick it off with you and then Fred.
Well, what I thought one of the interesting things to almost put a stake in it is COVID. COVID is here. COVID will probably always be here, but it has become one of the circulating coronaviruses that in most people doesn't have any significant effect, but occasionally, especially in people with the risk factors that we've talked about now for 4 years, it can become significant. But just to put things in perspective, and we've done this before, is COVID-19 has a hospitalization rate of 1.6 per 100,000. So if you put that in perspective, we have 100,000 people in the United States. So that's somewhere around just shy between 4,500 and 5,000 hospitalizations. That's not a huge number. If you think of deaths, COVID is responsible for about 9,400 deaths so far this year, whereas influenza is a similar number. So they're certainly they're at worst comparable, but it's not this big deal that we were worried about at the beginning. So I think that's just interesting. Just put that in perspective. One other point is that the only way we're able to get any kind of comparative rates anymore, because nobody's tracking positive COVIDs unless you're hospitalized with it, is looking at the wastewater. And nationally, wastewater rates are at the lowest they have been. Maybe not the absolute lowest, but right near the lowest they have been. The highest is in the Midwest, but even that is still at historical lows, over the last 5 years. So I think we can almost stop talking about COVID going forward and think about other things that may be of concern.
Fred, what else should we be thinking about?
Well, I think the influenza virus and the RSV virus actually are at this point more dangerous and the incidence of both those is higher than the coronavirus, although we're not tracking the coronavirus, so we can't say for sure. One of the things I think that's happened is, Bill and I were talking, is because so many people were infected, that allows the coronavirus, that's an RNA virus, remember it replicates very unfaithfully, so there are a lot of mutations. The more people that are infected, the more likely it's going to mutate. And it seems to mutate predominantly to become more infectious. And it appears that as it becomes more infectious, it becomes less deadly and less virulent. In other words, it doesn't cause a severe disease. And that's why it's progressed to the point of almost being like the other coronaviruses, which are no different than the rhinovirus and other common cold viruses.
I do note that the House is releasing its report on the origin of COVID, has released the report, and what they have said is that they believe that it did emanate from the Wuhan Institute of Virology. Wuhan Institute of Virology was doing gain of function research. They are a little bit careful about making a direct causative link, but it's now at least at that level a fairly good bipartisan assessment that this was related to Wuhan. And I think that what that's going to mean is that the international oversight of gain-of-function research and biohazard laboratory safety in general is going to be significantly raised.
Bill, as far as that goes, I'm a little concerned about that conclusion, because that is the conclusion of politicians. And as we've talked about many times, the science involved with COVID-19 has been overly political. And I would like to see a neutral scientific body come to a conclusion, because in my readings about when you look at the sequences of the viruses being used for gain of function and the sequence of the virus, the SARS-CoV-2, it didn't add up. So that's one of the problems I have with that conclusion.
Well,
I think
and that's why I think was actually good in the way that I have read in the report is they did not draw a direct association, and I think for exactly that reason. They said this institution is doing gain of function research, and they are confident that it came out of there, but they're not saying that it was directly because of the gain of function research that this release occurred. So I think that it's the truth. The truth is out there. We may not have the whole truth, but it's there.
They actually went a step further. They cited to U.S. Certain individuals. I don't want to go down the rabbit hole, but certain U.S. individuals who are active in the medical research space, having funded that research as well. And as you both have indicated in the past, this is obviously it is a scientific question, it's a medical question, but it is, for a variety of reasons, a very, very sensitive political issue in light of what resulted. I will note simply, because it's my profession, Fred and Bill, there are plaintiffs' lawyers who are ready to jump on this in terms of filing a class action claim and seeing what they might be able to recover from various parties. But we'll put that aside for now and just watch it more carefully. Bill, simply because people are going to be doing a lot of traveling, anything that people should just generally be aware of in light of where they often go, or whether it's on business or for pleasure?
Well, there's the one issue that had been getting a lot of press, and that was the Marburg virus outbreak in Rwanda. Marburg virus its colloquial name is the bleeding eye disease, because one of the things would happen is people would bleed through their eyes. But there has not been a case of Marburg diagnosed since late October. The last positive on the one case that was diagnosed in October was in early November. So as things stand now, there have been no new cases in over a month. And if we get to December 22nd without a new case, then the CDC and the World Health Organization will consider this outbreak to be completed. So that's good. And Rwanda is actually a common travel destination. People going to see the gorillas, and it's a relatively safe country to travel to. So it did have some implications. Beyond that, one of the things that I have been tracking very closely is the growth and relevance. I don't know if it's so much of a growth in actual numbers of cases, but certainly growth and relevance of arboviruses, meaning viruses that generally live outside of the big cities, but are making themselves known. The big ones are chikungunya and dengue. Dengue, there are vaccines for both. The dengue virus vaccine Should not be used, however, unless someone has had dengue already. And we don't have time to go into the reasons behind that. So most travelers could think of that as a non-vaccine preventable disease. You need to use insect precautions if you're traveling in the tropics. And then chikungunya, there is a new chikungunya vaccine. A lot of us who do travel medicine are just starting to get experience in the use of it. I think that chikungunya vaccine is going to increasingly be recommended and used for travelers to the tropics. At this point, if I have travelers going, I'm probably going to be looking hard at it. And if they're going to an area of increased chikungunya activity, I believe I will be recommending it. But there are other arboviral vaccines out there, plus malaria, lots of insect-borne diseases. So if you're going to a tropical area, make sure you've checked the disease status, and in almost all circumstances, using insect precautions, meaning DEET, pyrothins, wearing long sleeves, light-colored clothing, is going to be very important to keeping yourself safe.
Fred, I assume you would agree with all of that.
Yes, I completely agree. I'm particularly concerned about dengue because that can be fatal and can be very, very serious. And chikungunya, you get severe arthralgias and arthritis, which can be very discomforting as well. So both those are, and we saw an upsurge of West Nile earlier this year and Eastern equine encephalitis also, which are mosquito-borne. So I think as our climate becomes more humid and moister with more rain, you're going to see, and warmer, you're going to see the spread of these viruses.
Including, and not just in tropical areas, including in the United States. I mean,
exactly.
We're seeing dengue, chikungunya. When Fred had talked about the equine encephalitis, that's happening up and down the East Coast. So it's something to be aware of. And even just people routinely, summer outdoors, you probably should be thinking about DEET.
I thought it would be helpful to hear from both of you, just your general perspective about vaccines, the benefits, the risks, safety, how we monitor, issues related to it, and just your general overall sense and advice that you give your patients and the broader medical communities and what a broader audience about the safety, efficacy, any related concerns around vaccines.
I think from my point of view, people generally think of that it was the biggest life-saving development that we had in medicine was the development of antibiotics. But I would challenge that, and I think that the development of vaccines probably have saved more lives and more morbidity than even the development of antibiotics. But that doesn't mean that every vaccine is perfect. I mean, we saw the early RSV vaccines that caused GI problems in little babies, and lots of babies got sick and had to be operated on even because of a vaccine. So not all vaccines are perfect. We've got to be careful. We've got to have a rigorous program to ensure the testing. As you know, I have not been a strong advocate of the follow-on booster vaccines for COVID. But I was very much in favor of the initial vaccine because even if there were some risks, the benefits were pretty clear. And I think the test of time has proven that those benefits are clear. So my general sense is that vaccine's good, but we do need to have a robust vaccine development, testing, and monitoring program as we develop vaccines.
And do you feel that currently exists, Bill?
I'm pretty comfortable. I mean, I think that we did rush COVID vaccine, but we had to. There wasn't a choice. We were having deaths. We were having thousands of deaths a day, so we had to rush that. And that's sometimes you take some risks, but I think that in general we have a good program. I think the FDA on vaccines, the Advisory Committee on Immunization Practices at CDC, I think are good organizations.
Of course, I agree with Bill. Just think about it. Smallpox no longer exists as a human pathogen. That is because of vaccination. Polio, which used to be the scourge every summer, and I remember as a child being very frightened and my parents not allowing me to go in a swimming pool because of the great danger of polio virus. That is virtually gone, although there were small pockets. And interesting, in Gaza, polio took a rose because of the lack of vaccination. So those are just two. And then the fact that we rushed the vaccine, which, as Bill said, we had to, some of the media called into question the safety because it was rushed. However, the rush was just in the specific content of the virus, but actually the methodology had been worked out for over 20 years. And the virus and this vaccine is now, I think, proven beyond a shadow of a doubt. This is, if not one of the safest, maybe even the safest vaccine we've ever given, because it has no protein in it. It has various salts, and so there isn't the danger of many of the autoimmune phenomena that we saw, particularly Guillain-Barré has not been reported significantly in this virus. Now, there are, when you rev up the immune system, people that have autoimmunity will get may make their disease worse. But that's true of any vaccine. So, and I agree with Bill, I think the surveying, the monitoring of the virus has been very, very good. The problem we have is people, when millions of people get the vaccine at X time, during that same period X, there will be a background of various illnesses. Now, if you have the vaccine during that time, they will blame those illnesses on the vaccine. However, they would have occurred anyway and had nothing to do with the vaccine. So that's where we get the problems. And somebody knows somebody that got the virus and then something horrible happened to them. And unfortunately, people react to individual stories more than statistics. But statistically and by every measure, this has been a very safe vaccine.
Well, I want to thank both of you, and obviously wish you the very best for a safe and very happy holiday season. I'll end just with maybe a rhetorical question, but you both are advising people to take the flu vaccine and have found it to be both safe but also effective. Fair note to end on?
Yes, I got my influenza vaccine. Did you, Bill?
I got mine. I always get mine the middle of October, unless there's an early outbreak. Yes, about the 15th of October is the time to get it.
And just so people know, I actually listened to your podcast.
Oh, good.
I did as well. Maybe a little bit closer towards the end of October, but I got mine as well.
Good.
So, all right, guys, stay safe and well. Again, always thank you for the time and all the best, and not just you, but the audience for a very safe holiday season.
Thank you, David.
Take care.
Happy holidays.
Bye-bye.
Take care.
This was the latest installment of the Beyond COVID podcast from RANE Network. For more information about the RANE podcast series, or to discover RANE's wide range of offerings on risk intelligence, please visit ranenetwork.com. That's RANE network.com. Thank you for listening.